This is my IV administration video. I'm just going to scan the room for you. My name is Evie Lackey, and now I'm going to be, before I come in, I want to ensure that I'm doing the right drug today. So I want to look at the orders. It has been ordered that due to bilateral crackles in the lungs and some pulmonary edema, it looks like we're ordering some Lasix for this patient. The physician has. They are ordering 40 milligrams, and all we have on hand is 10 milligrams per mil. So we're going to need 4 mils. So I want to come in. I want to make sure I have the 5 rights. I want to do the right dose, the right drug, the right patient, the right time, the right route, and then sometimes there's the right documentation for the 6 right. And then I want to also have ensured that I checked before I came in the order. That's my first check when I'm getting it out. And then when I get here, I want to check the MAR. And then my third check is always at the bedside when I'm drawing it up. So I'm going to inform the patient. I would have done hand hygiene when I came in, asked the patient their name and date of birth, and now I'm going to inform them a little bit about Lasix. So why they're getting the Lasix due to the pulmonary edema, the crackles in the lungs. It'll help to get rid of the excess fluid. And then I also want to let them know that you could get increased thirst. You might want to urinate more frequently. You might have some diarrhea. These are just some of the side effects. So now I put on my gloves and we're going to draw up the Lasix. So I need a syringe for that. And again, I'm doing my checks here by checking at the bedside, make sure it's the right amount that I'm drawing up. So we're drawing up Lasix. I would be drawing up 4 mils according to the order. And I would have pushed 4 mils in and drew up 4 mils. This is a 3 millimeter 3 mil syringe. This is all that I have on hand, but we're going to pretend I drew up 4 mils. So after I drew that up, I can lock that. I want to make sure there's like no bubbles or anything. And then I'm going to let the patient know now I'm going to flush their IV. So I have a 10 mil syringe for an IV to flush. That is most important. So the first thing you want to do is just always to clean for 15 to 20 seconds around there. And then we are going to unclamp this IV, this port right here. And then we're just going to connect the port. I'm checking for patency of this IV. I just have it in a little bowl right here, but I'm checking to make sure. So I'm just going to push about 3 to 5 mils. It looks good, looks patent, no phlebitis, no infiltration that I'm seeing. If there was, I would obviously not infuse any medication, and I would notify the provider. I would remove the IV and such. So now I'm going to put this in the sharps, but I'm going to reuse this for this video, and I'm going to clamp this IV back in between uses. So now that is clamped down here. So now what I'm going to do next is I'm going to push the medication, the 4 mils, and I would need another sterile pad for that. So I'm going to scrub that hub for 15-20 seconds again. And now I'm going to push the medication by removing the needle, putting that in a sharps container, and I'm going to put this up here. I need to unclamp the medication, and I need to push 4 mils over 2 minutes is what it says in the drug book. So I'm going to do it a little faster here, but that's what I would do over 2 minutes according to the drug book. So now I want to undo that, put this in the sharps. I want to clamp this back And now that that's clamped without touching the end right there, because you want that to remain sterile. And then now we're going to scrub the hump again. 15-20 seconds. Now we're going to flush the rest of our syringe. So I'm going to, and you want to flush the 4 mils that you flushed. You want to flush the 4 mils of normal saline, since that's what you flushed of the medication. I unclamped it, and you want to do it over 2 minutes, the same as the medication, because you are now moving that medication through the line, and you need that to be moved at the same rate. So again, no like speed shock or anything like that. So over 2 minutes, I have now pushed in 4 mils, and I will now clamp this back. Now I will just document how the patient took the medication. I will document that I gave the medication, the time, and that I did the 5 writes and the 3 checks, and I will give the patient their call light and ask if they need anything else. Thank you. I would also do hand hygiene.